Do you happen to know exactly what happens when you have a heart attack? Well, if you don't, stick around and you're going to find out. Hi, I'm Dr. Rasi, cardiologist from Houston, Texas, and welcome to another episode of Ask Dr. Rasi. In this episode, I thought we would focus on what heart attacks are. Now, I'm not going to get into a long description of exactly how they occur, the complex physiology, and how we need to prevent them. All that will be discussed in another episode. Today, I'm just going to focus on a basic anatomy and physiology lesson and a short description of what it means to have a heart attack. I'll also touch upon what we can do about it. Now, I thought about putting together this particular video because of an experience I had with one of my own patients. Now, this particular patient had had a stent placed into his heart some time ago, but when I talked to him, he seemed very confused about whether or not he had a heart attack. I realized that this confusion was probably because he didn't quite understand exactly what it means to have a heart attack. So let's take a look. Before we understand exactly what happens during a heart attack, I think it's very important to get a grasp over some of the basics of anatomy and physiology, and altogether how the heart is put together. Remember, the heart is a pump that supplies blood to the rest of your body, and your body depends on this blood supply to keep its vital functions going, because it needs to receive a vital supply of oxygen and nutrients. Now, an interesting thing just happened here. If I just said that the heart is a pump that supplies energy to the rest of the body, what supplies energy to the heart muscle itself so that it too can function properly? Well, that's where things get really interesting. You see, on the very top of the heart are a group of blood vessels called the coronary arteries. The word coronary or corona means crown in Latin, and it was so named because those arteries look like they were crowning the top of the heart. These arteries in reality steal a little bit of blood from the heart itself and supplies that blood back to the heart muscle. Suffice it to say, those blood vessels are the very lifeblood of the heart and the reason that the heart can continue to pump in the way it does. So now let's take an example. Suppose you're an elderly gentleman who has a number of risk factors for heart disease like hypertension, high blood pressure, high cholesterol, or diabetes. Now, these disease processes can damage the lining of the blood vessel wall, called the vascular endothelium, and these damages happen over time. It can also cause a lot of damage in the coronary arteries itself. Over time, plaque can deposit on the arterial wall, and in a matter of seconds, one of those plaques can break off, causing a huge cascade of events that result in a blood clot forming right where that plaque broke off. Now try to imagine what happens. A blood clot formed almost instantaneously inside the coronary artery when there was no blood clot before. Blood flow through the artery and therefore into the heart muscle suddenly stopped flowing. When there is no blood flow to power the heart muscle begins to slowly starve and it eventually dies. That, my friends, is what we call a heart attack. When the heart muscle begins to starve, people will usually describe experiencing a substantial amount of chest pain or chest pressure, sometimes pain in their left arm or pain that runs to their left jaw. They may also describe difficulty breathing, sometimes profuse sweating, lightheadedness, or dizziness. Once the heart muscle eventually dies because of the lack of blood flow, the blood flow to the rest of the body also stops, and this will result in inevitable death. And that is exactly how someone can die from a heart attack. But if you can get to a hospital in time, a cardiologist can perform a specialized procedure called an angiogram to first look at exactly where the blockage is, and then do an angioplasty or stent implantation where he can carefully thread a wire across the blood clot and deploy a stent, which looks like a wire mesh tube, into that location where the clot is, and open up the artery so that blood flow can resume. In reality, the whole process can happen within an hour or two and sometimes even faster. So remember, if you are experiencing sudden chest pain, chest pressure, shortness of breath, or lightheadedness or dizziness, don't wait around. In cardiology, we have a saying that time is heart muscle. Every minute you waste can result in more damaged heart muscle and bring you that much closer to death. If you think you may be having a heart attack, my best advice is don't think. Just get to the nearest emergency room and let the medical professionals help you. So I hope this little video helped clarify this for you. If you enjoyed this video or enjoy videos like this, please support me by hitting the like and subscribe button below and turn on notifications so that when future videos like this are posted, you will receive a notification. As always, if you have any questions about this video or about anything else, or have any interesting questions you'd like me to comment on, please leave a comment here or send me an email. Please visit my website on www.drrasi.com. Until next time, have a happy heart.